Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video and the next video, we're going to be discussing the best practices for strengthening shoulder external rotation. Now, in this video specifically, we're going to be looking at strengthening external rotation in the neutral position of the shoulder, where the arm is right by the side. In the following video, part 2, we'll be looking at strengthening in two other major positions. Those are 90-90 flexion and 90-90 abduction, so make sure to take a look for that video. A lot of times you'll have patients that come into the clinic and they may have limited shoulder mobility overhead. Maybe you ask them, raise your shoulder up, and they're like, I don't got any more. Or maybe they do have more and it's just incredibly painful, maybe at or beyond that 90-degree mark. And so those might be certain situations where you might want to begin, if you need to strengthen external rotation, to do so in a position that's not going to challenge that overhead mobility like the 90-90 positions would, that we'll see in the next video. So you might choose to start out strengthening external rotation in this neutral position right here. Now, before we get too deep into the exercises, I think it's important to take a step back, take a look at the relevant anatomy so we know what it is that we're going after in the first place. And this anatomy that we're going to see, this is valid for strengthening, as I mentioned, in the neutral position, and also when we get into those 90-90 positions in the next video. So there are 4 rotator cuff muscles. You've got on the anterior side of the scapula, which you cannot see in this image right here, you have the subscapularis. That is one of the internal rotators of the shoulder, and we'll be covering internal rotation in a later video. It turns out there's a lot of other muscles that actually facilitate internal rotation of the shoulder, including the pectoralis major, the latissimus dorsi, teres major, not to be confused with teres minor. So subscapularis has a ton of help there. Now, sitting atop the scapula in the supraspinous fossa, that space on top of the scapula, we have the supraspinatus muscle, which happens to be the most commonly injured of all 4 rotator cuff muscles, and it is a minor contributor to abduction of the shoulder. On the posterior aspect of the scapula, we have our 2 external rotators. Those are the infraspinatus, which is much larger, and it's the superior of the 2. And then below that, we have the smaller teres minor. Teres major is different. That's inferior to all that. Teres major is essentially a baby latissimus dorsi. Okay, it extends the shoulder, it adducts the shoulder, and internally rotates. The teres minor, that is an external rotator of the shoulder and one of the 4 rotator cuff muscles. Now, all 4 of these rotator cuff muscles have their own individual functions, whether it's internal rotation from the subscapularis, a little bit of abduction from the supraspinatus, and it's mainly the first 10 or 20 degrees of that. These 2 that we're talking about in this video are external rotators, but generally speaking, all 4 of them provide a substantial amount of glenohumeral, or shoulder, stability. And the stabilization function of these muscles would be isometric in nature. And we'll talk about in the following video why isometric strengthening, that is promoting stability, like with a weight or carry or something like that, is actually not optimum for getting the most strength gains out of these muscles. We'll talk about that in the next video. So understand, for the time being, we're going to be looking at purely external rotation strengthening, and that's going to target these 2 muscles right here. So without further ado, let's take a look at the major strengthening exercises for ER in this position, and we're going to start with isometrics. Mainly because not everybody that comes into the clinic is going to be able to do a dynamic external rotation resisted exercise. But after we cover the isometrics, we'll get into those dynamic exercises. Now, the main focus of this particular video is going to be strengthening of external rotation of the shoulder in a dynamic resisted way. However, one of my core tenets of exercise selection is making sure that the exercise is appropriate for the individual. So let's suppose you or someone that you're treating has a pretty significant rotator cuff tear, and maybe they're not tolerant to even active range of motion yet without resistance for internal and external rotation. Well, if they're not really tolerant to that movement, and you even try maybe a banded version of this with a little light resistance and they're not tolerant to it, well then it's not appropriate for them at that moment. And it is totally okay to start with isometrics. And we usually do it at the edge of something like this, or at a wall or a door frame, okay? Isometric just means that we're engaging the muscle, but there's no actual movement, okay? So what we do is we put a towel here in the armpit. We're gonna get more in detail on that in just a minute after we discuss this. And we're gonna put usually the back side of the wrist against the edge. The movement we're trying to engage is external rotation. But obviously this little bar right here isn't going anywhere. I'm pushing, I'm pushing, I'm pushing. Obviously it's not going anywhere, but all those rotator cuff muscles in the back, the infraspinatus, the teres minor, they're all engaging, and then I relax, okay? There's no actual set time that you have to hold it for. I usually will start patients with 5 seconds, work up to 10, but realistically, as soon as these isometrics become pretty easy and they start getting a little bit of improved strength and movement tolerance, we'll go right to the dynamic isotonic strengthening exercises, and that's what we're gonna go to right now. But don't forget that some people, maybe even yourself, might have to start with isometrics. That is okay. So when it comes to strengthening shoulder external rotation in the neutral position, meaning arm by the side like this, there's one really important consideration, and that is gapping the shoulder. Oftentimes you'll see people take a rolled up towel or a small pillow and they'll put it between their arm and the torso when they're doing this exercise. Now, I have a towel here, yes, but this positioning is not ideal. We'll get to that in just a minute. We need to understand the reason why you would gap the shoulder in the first place, gapping the shoulder joint, that is. So if I keep my upper arm here, the brachium, right by my side, I'm gonna show you exactly how much external rotation I have, assuming it's pinned right there. So start here, going out, going out, going out, and probably about right there. In order to go any further, I'd have to compensate. So it goes to about right there. If I take this towel and I'm actually gonna put it all the way up in the armpit, so I gap the shoulder, and now I look at my external rotation, I've got quite a bit more motion that I can move through, okay? So the reason we gap the shoulder joint, one, it helps improve blood flow to the shoulder, but we're able to move the shoulder from that internally rotated position through external rotation through a larger range of motion, meaning we're gonna get more work out of the muscle. Now, I put that towel all the way up in my armpit. A lot of people will stick it pretty low in there, and that doesn't really do as good of a job gapping the shoulder joint down here. If I take this and put it all the way up in the armpit, I'm gonna be able to move through a definitively larger range of motion. I'm gonna get more work out of those external rotators. So don't put it down here all the way up in the armpit. That's the first big consideration. The second big consideration, particularly when you're doing this with a cable or a band with one arm, is the nature of the movement. So here's what I see a lot. I see people take the band and they just rotate the forearm straight out, okay? Will this work the external rotators of the shoulder? Absolutely. But you're also getting a pretty large compensation from the triceps. Notice that as I start out here, my elbow is roughly bent to 90 degrees, but as I'm rotating out, my elbow's actually extending. You can see there, that's 90 degrees. This is something beyond that. So in order to go from here to here, if I'm going straight out, I'm actually recruiting a lot of the triceps, and that's a compensation that we don't want. So my recommendation, whether you're doing this from a cable machine with a little handheld attachment or a band, is notice the direction that I'm anchoring the band to. It's gonna come approximately to mid-thigh level. So it's gonna be lower than we would expect. What this allows me to do is when I externally rotate, I can keep my elbow joint at 90 degrees, okay? Not here, that gets a lot more triceps. Here, keep that elbow joint at 90 degrees. This is going to maximize recruitment of that infraspinatus and teres minor, okay? Another compensation you might see is too much elbow bend, like this. That's getting a lot more biceps. Is it working rotator cuff? Yes, but not optimally. To work it optimally, keep that elbow joint at 90 degrees. So you notice that when we have that shoulder gapped, there's a little bit of an upward trajectory of that forearm, okay? This right here is proper form on a unilateral external rotation exercise. Again, we can use a band, We can use a cable machine, but make sure you keep that elbow joint at 90 degrees the whole time so you don't have the biceps or the triceps taking over the movement. Optimally work the external rotators. So that unilateral external rotation exercise I just showed you is a really good ER strengthener when you have a few things satisfied. So number one, those isometric wall external rotations, those are getting too easy. They're not giving as much bang for the buck anymore. You need to progress to a dynamic resisted exercise like that one. Number two, when a person really doesn't have good overhead mobility or overhead mobility is just really painful, right? If it's really painful or they don't even have it to begin with, there's no reason we would be strengthening here and here, right? We build up to it. And then the third reason would be if, let's say from that example, my right external rotation has really good strength. My left one, it's getting better, but it's still got a pretty big discrepancy side to side. When you got those three things satisfied, that unilateral exercise is fantastic to start helping iron out those side to side differences. But let's suppose now you've got your weaker side and it's starting to catch up to the stronger side. So now they're a little bit more comparable. So maybe now I choose a bilateral exercise and get both sides even stronger. And I'm going to switch it up for this example. I'm going to say that maybe my right side, this is the weaker side now. Not that much weaker, but just a little bit weaker. So I could put a towel under both arms, but if I've got one side that maybe needs just a little more oomph to it, maybe a little bit more help, I'm going to choose to put the towel on that side, okay? So I'm trying to go after my right side a little bit more here. So for this bilateral external rotation strengthener, I'm going to take a band like this. It can be a regular TheraBand or a little monster band like this, underhand grip, and then I'm going to engage external rotation like this. Again, same rules apply. Remember, we want to keep those elbow joints at 90 degrees and don't come out too much like this because that starts recruiting more triceps. So right here, and then come back in. With this exercise in particular, I really like to emphasize the holds on it. Maybe 3 to 5 seconds, nothing crazy, but really just make sure we're engaging those external rotators. The other thing I'm doing that you can't really see too well here is I'm trying, before I ever start the external rotation, I'm kind of squeezing my shoulder blades together, locking out that scapular retraction and then performing external rotation. And that really just ensures that if I have that retraction pre-engaged, that I'm really getting the most out of those external rotators and not getting other things in the scapular region to try and compensate. But that is bilateral external rotation. Now, we're going to go back to unilateral external rotation strengthening, but we're now going to do it in Sidelying. And the side that we're working is the side that is face up here, okay? What we're going to do is stick that rolled towel once again in the armpit, okay? And the idea here is when we start doing the external rotation, one of the common compensations is people will try to lift their arm up. We don't want to do that. We want to maintain a gentle squeeze, not as hard as you can, but at least a little bit, maybe 10, 20% of your maximum isometric force on that towel, and that's going to prevent the arm from lifting up and getting some unwanted compensation, okay? By keeping this little gentle squeeze on the towel, the movement is isolated to that of external rotation, okay? You might need a pillow if this kind of puts a little strain on your neck. That is okay. But we're going to use a dumbbell for this. So maintain that gentle squeeze there on that towel. Rotate up, okay? Control the eccentric down. Rotate up. Control it down, little pause at the bottom. Come back up. This is a really good one for strengthening external rotation, mainly because it really avoids compensations that you might have with the other two exercises. Something that often happens with the banded one that is unilaterally banded is people will kind of lean a little bit and get a little lumbar compensation. You can even have a little lumbar extension on the bilateral exercise. This one, it is a lot harder to compensate if you're keeping this arm pinned against the side with that towel. And if done correctly and you keep that elbow joint at 90 degrees, you will really start to feel a combination of burn in the infraspinatus region on the scapula, and then a little bit of that anterolateral shoulder burning. Remember, that's usually where we perceive work or pain in the rotator cuff muscles. But in this case, assuming I'm not having any pain and it's just a sensation of burning, that is literally just the infraspinatus and teres minor working really hard to perform this movement. So this would be side-lying dumbbell external rotation. So when it comes to strengthening shoulder external rotation, remember, how you go about strengthening these muscles, infraspinatus, teres minor, it's no different than how you should strengthen any other muscle in the body. If you're looking to get the most strength gains out of these muscles, which is what a lot of patients need in the clinic, your dynamic resisted exercises where you're actually moving against resistance, these are going to give you superior outcomes compared to the isometric counterparts. And we'll see more examples of that in the following video when we cover these elevated positions, 90-90 flexion and abduction. But hopefully this video gave you some good information on best practices for strengthening ER in the neutral position. So please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.